Hello people, this is StupireMed Insta question number 4. Which of the following is false with respect to tuberculoid leprosy? A. Tuberculoid leprosy is the most severe end of the spectrum of leprosy. B. Spectrum of tuberculous leprosy encompasses TT and BT disease. Symptoms are confined to the skin and peripheral nerves. D. TT or BT leprosy is the most common form encountered in India. Let me begin by telling you the spectrum for leprosy. As we start from the best of the investigative spectrum, in terms of immunity, the best spectrum would be tuberculous leprosy. Slowly, when the patient has lesser and lesser immunity, it becomes tuberculin, but it's a borderline. You call it as borderline tuberculous. Then we have something called as borderline. Then we have something called as borderline lepromatous. And the worst situation would be lepromatous leprosy. If I perform lepromin test, it will be positive for tuberculous leprosy and negative for lepromatous leprosy. That is an indication to tell you the prognostic power of the particular test called as lepromin test. Here in tuberculous leprosy, the CMI is present, intact and fights against the organism. In lepromatous leprosy, the CMI is present but not able to or not willing to fight against the organism. So, tuberculous leprosy is the best immune status, while lepromatous leprosy is the worst immune status. So, this would be the severe end of leprosy. That makes option A the right answer and the false statement. B. The spectrum of tuberculous leprosy encompasses tuberculoid and borderline tuberculoid. That's a true statement. So here tuberculoid leprosy and borderline tuberculoid belong to the spectrum of tuberculous leprosy. While if you think about the lepromatous leprosy spectrum, you will have both lepromatous leprosy and borderline lepromatous. Symptoms are generally confined to the skin and peripheral nerves. The reason being they are the cold parts of your body where the temperature is not the same as the core body temperature. TT and BT leprosy is the most common form encountered in India, and that's a true statement. And according to Harrison, option A is the false statement. At the less severe end of the spectrum is tuberculoid leprosy. In general, these forms of leprosy result in symptoms confined to skin and peripheral nerves if it is tuberculoid leprosy. AFB are generally absent or fewer in number in case of tuberculoid leprosy. Tuberculoid leprosy patients may have asymmetric enlargement of one or a few peripheral nerves. But if it is lepromatous leprosy, it will involve more number of peripheral nerves. The skin lesions of tuberculoid leprosy consists of one or a very few hypopigmented macules or plaques. But if it was lepromatous, it was spread all over the areas. It can cause deformation of your face, which can be referred to as leonine phases, which is absent in case of tuberculoid leprosy. Hope it helps. Thank you.